Hi everyone, this is Bakshi Sidhu, and I'm here joined today with Dr. Ali Ajaz, and we have got an exciting collaboration for you. We've got lots of great information to share. First of all, I'd like Dr. Ali to introduce himself and tell us about himself and what he does, and we'll take it from there.
Oh, thank you, Bakshi. Hi, everyone. It's an honor and pleasure to be here today. For those who don't know me, I'm a consultant psychiatrist. I work in my own practice between London and online, and I've been working more in the functional health space to really look at root causes of why people get sick, especially when it comes to their mental health, and what things beyond medication can really help make a difference. And I like to look at the way the approach as a focus on brain health. So how much can you invest in your brain health? And the more you invest, the more things will improve. And what I find is most mental health issues improve by people making positive action and changes in their life. And that's really a passion of mine. And that's really most of the clinical work that I do these days is focused around brain health and trying to encourage people to lead kind of happier, healthier lives.
That's amazing. Thank you. Thank you. Just a short introduction for myself. I'm Bakshi Sidhu. I'm a parenting and life coach with a real focus on ADHD. So majority of the families that I support either have ADHD themselves as parents or their children have ADHD. And one of the things that we do is explore exercise, brain health, nutrition, diet, understanding themselves a lot more better and not just relying on medication. And that's what drew me to Dr. Ali's work because I was like, we need to be talking more about brain health, nutrition, not just about the medication that psychiatrists are going to be prescribing. And I do find talking to parents that they almost rely too much on the medication, that there's a lot we can do beforehand while we're waiting for a diagnosis, and then even after, or we're not solely relying on medication. So this is why this conversation is going to be great for parents, whether it's neurotypical, neurodivergent, for teachers, head teachers, anyone working with families and children that are really struggling with brain health. So let's get started with some questions. I've got questions that we have explored together. And I've also got questions from the parents that I work with. So let's talk about, first of all, the nutrient deficiencies that you find when you're working with children with ADHD. What has research shown you, and what do you do?
So it's a great question because it's fundamental, and this is the obvious things often get missed.
Yeah.
And I'm talking for doctors rather than parents,
Yeah.
because doctors should know these things, but we don't. And nutrients are so important for everything. And if we're looking at children in particular, the whole development, but in particular the development of the brain. So we call things like autism and ADHD like neurodevelopmental issues. We're really talking about the brain and the nervous system developing in a way which is off trajectory slightly, that leads to a certain group of challenges and difficulties, what we call symptoms, that come as a result of that. Now, if the brain doesn't have the right fuel, so we're talking about the nutrients, the vitamins and minerals, it's not going to develop on a conventional trajectory. And so this is something that gets missed when we talk about, well, why do people develop ADHD or autism? What contributes to that? It's multifactorial, but nutrients are really key. If the brain doesn't receive the right nutrients, it's not going to grow and develop. This is essential fuel for our nervous system and for our overall development. So that's the first thing. On a very fundamental level, nutrients are everything. And we eat food because we get nutrients from food. So it's such a key part of the conversation, which is just not being had at all. And what the research shows very clearly is that children, and most of the research on ADHD has been done on kids, that not only are they more likely to be nutrient deficient, but it's more likely to be three, four, five nutrients together rather than a single one. So we're talking about things like zinc, iron, magnesium, copper, a whole range of B vitamins across the board. And there's no consistent ones that are aligned with, say, autism specifically or ADHD specifically. but the research is very clear. Omega-3s is another one, and there's research I came across saying up to 70% of kids are deficient in omega-3s. And omega-3s are really important because these fatty acids is what majority of the brain, the hard mass of the brain is made out of. Very fundamental for development. Um, but even more exciting than this idea that nutrients contribute to ADHD and neurodiverse issues, is that if you give kids and adults nutrients back, then they can make a lot of improvement in terms of their symptoms and quality of life and overall how well the brain is functioning.
That's amazing. No, it makes so much sense. And like you said, it's so overlooked. And it's
Mm.
often, and it's, to be honest, it is overlooked by parents as well. I mean, some may give a multivitamin and think that's enough, but actually dissecting and figuring out what other deficiencies might be there for their children. So when parents come to your clinic, how do you check for these deficiencies?
So I have a general principle where there's an assumption that if someone is struggling with their mental health in general, but in particular neurodiverse issues, once you take the history, once you look at the diet and nutrition and the nature of the problems, it's more than likely that
Okay.
they are deficient in nutrients. So I don't check routinely.
Okay.
And I would much rather people pay for the treatments rather than the testing. We can test, and some people really want to, and that's absolutely fine. But
Okay.
for many people, money is an issue, and I'd rather people spend money on the things that are actually going to work rather than an inquisitive look into these functional testing, which I do. I'm happy to do, but if it's a toss up between one or the other,
Yeah.
and if money is tight, then usually the nutrients. Now, the really interesting thing is that there have been clinical studies on nutrients, and there's a specific multivitamin that I use based upon the research. And the research is very rich, so very, very unique because most supplements, most multivitamins don't have any data or research to back
Hmm.
up anything that they claim or even talk about your general health. There's no data. So to find a particular formulation that has not only studies but robust clinical studies showing a positive impact on children with ADHD and their symptoms without the need to test. So this is someone with a diagnosis who then takes the multivitamins for 8 to 10 weeks and then seeing symptom improvement close
Hmm.
to what we see with the medication is quite remarkable. So the research says we don't routinely need to test
Okay.
for people to get the benefits. And for some people, it's because things are deficient. For other people, it's things aren't optimal. So deficiency is something that we talk from a medical sense because that's what doctors are used to. Oh, well, we'll
Hmm.
do this test, and what are the guidelines saying? What's low and what's high? And if you're just over the just over the lower boundary, it's fine. You're in the normal
Yeah.
range, and just carry on with your life. It's all good. This is these terminologies are quite unhelpful, and they
Okay.
feed a kind of an old ancient way of trying to understand health. So often it's about optimization.
Mm-hmm.
It's not only are you not deficient, but do you have enough for what your brain needs? And everyone is
Yeah.
slightly different when it comes to that.
Yeah, that's so true because optimizing is trying to get to the top end of things rather than just being at the baseline. I think that's enough. And each body's different, each child's different. How to
Yes,
metabolize things will be different too. And I'm glad you said that wait until 8 to 10 weeks, actually, because you can get some people that just supplement for a few, 2 weeks and say, oh, nothing worked, it didn't work.
mhm,
I'm not going to continue. And actually,
yes,
8 to 10 weeks is really important to really see the difference.
yes. So everything has pros and cons. So with the supplement approach, the con is that you have to wait longer
Yeah.
than say like a medication or a
Yes.
drug, which
Yeah.
is designed very specifically to have a distinct impact. So with the nutrients and any, I'd say lifestyle medicine, more generally, any lifestyle changes you're going to make, yes, it's not going to take years, but we need to give it a good couple of months, 8 to 10 weeks, and this is what the research shows. People often before, but we need to give it enough time to be able to
Hmm.
evaluate. And that's really
Mm.
really the ballpark figure that we're looking at. And the other key thing about nutrients is that it's high dose, right? So the research shows that high dose micronutrients, and parents often worry when you say kind of high. Well, high is just a relative term. It's higher than one or two capsules of something which is low concentration of nutrients that you probably pick
Okay.
up from Boots or Holland and Barrett.
Yeah.
Um, the higher dose nutrients, we're looking at this particular formulation of 12 capsules a day, which sounds
Sounds a lot.
horrendous. It sounds horrendous. But the trials have shown that from even kids of 6 years old, it's very safe. And
Okay.
there is, and I'll share the link for the
Yes,
platform where you
please,
can
because I'm
look at
sure
all.
people will be asking.
Yeah,
Yeah,
yeah. But
that'd be
where you can look at the research. And I like full disclosure, what I've had to do, but once I saw the research for this formulation, I had to get that specific formulation to start using in my own practice because it didn't make sense to go to Holland and Barrow and get
yeah.
something less. That's something that's not been tested. And it's a formulation by a Canadian company. And in the UK, there's no one providing that formulation at the
Okay.
moment. So I'm working with them to bring it over here. So I do have um, a working relationship with them to import and make available that supplement
Yeah,
here.
yeah.
And I can rest assure you, it's the last thing I want to be doing, packing and shipping supplements. But it's the only way to make it available for the people that I work with.
Yes, yeah.
And so that's I have a working relationship with them because no one else is doing it,
Yes.
and I can't recommend things that haven't don't have the science behind it and the
That's
trials
yeah.
behind it, and that's really important for me. But because of that, I can confidently say that 12 a day for children 6 years plus has been shown to be very safe.
That's amazing. No, it's good that it's research backed and you've checked it all out for us. If you don't mind sharing the link after, that would be
Yes,
great. That would be really helpful because then, us regular parents are going to be just relying on vitamins from Honda Barrett's, Boots, Amazon. And again, they're not
yes.
time tested. We're just going with what seems to be the most popular. Unless somebody is promoting something, we're not sure. We're sort of struggling. Which are the top, just to confirm again, what are the top vitamins and minerals that you think that we should be taking just as a baseline for neurodivergent children?
So really, I'm an advocate of a multivitamin,
Okay.
and there's two main reasons for that. There's a number of reasons, but one is that if you take too much of a single nutrient, say vitamin D,
Okay.
um, they work in teams, but they also work in pairs.
Hmm.
So if you take high doses of vitamin D, you can really affect the dose of or the levels of magnesium because vitamin D uses magnesium a lot to do its kind of actions and its synthesis and the impact that it has on different systems of the body. It uses magnesium. So if you're then not supplementing with magnesium with higher doses of vitamin D, for example, you can cause an imbalance. So giving a multivitamin that has almost 30 vitamins and minerals, you're giving the body what it needs.
Okay.
And you're saying to the body, I trust you, you know what to do with it. I'm not being so prescriptive. And as doctors, we like to be prescriptive. We like to say, well, take a bit of this and a bit of that, and this will help this. And if we've got
Yeah.
blood tests, then we increase this by giving this single thing. And it's very reductionist, right? So
Right.
the science we have, the medicine we have is very reductionist. We like things to be easy. This is
Hmm.
low, so we'll give you this to make it high, and there we go, happy days. But the body doesn't work like that because
No.
everything is interconnected. And so by giving a multivitamin, you're giving these essential nutrients, and they're essential because the body can't make them. We need them from external sources. We need them from food.
Okay. Yeah.
But we can talk about food in a moment because it's not what it used to be
Yes.
in terms of nutrient density. So you give the body what it needs and you allow it to do what it's designed to do. And that's the beautiful thing about a multivitamin rather than specific nutrients. However, people with ADHD, for example, autism, do benefit from magnesium.
Mm.
Magnesium is a very calming nutrient. Often, a lot of people are low on vitamin D, especially during the winter months.
Hmm.
And not only does that play havoc with mental health, but physical health as well. So there are single nutrients that I do recommend at times, often. But as a general multivitamin, magnesium to help calm, to help sleep can be very effective. And vitamin D, I think most people probably need to be on
Yes.
vitamin D
I would say,
for probably
yeah.
most of the year, to
Yeah.
be honest.
I've heard lots about vitamin D, making sure you take that, especially the winter months, brown skin and all sorts. So, it's very important.
Yeah.
You mentioned
Yes,
magnesium.
most yes.
Sorry. You mentioned magnesium, and one of my parent clients wanted to ask. So they give their child melatonin in the evening, and
Mhm.
could they also give magnesium? They don't know what to do. What's your expert advice on that?
Yes. So I do have people that use combinations of magnesium and melatonin for sure. Melatonin is interesting. It's only in the UK, as far as I'm aware, that it's classified as a prescribed
Yes,
medication.
yeah. Other places you can get them
Other
quite
places
quickly.
you can just go to the pharmacy, so
Yeah,
where you can get your paracetamol and your chocolate bar and sandwich and also some melatonin.
melatonin.
But in this country, you need a prescription from someone like me. So I guess that's something just to point out that we do need things prescribed like that in this country. Um, but the beauty around nutrients and supplements in general is that they're less potent in terms of toxicity and side effects
Hmm.
than medications and drugs, and we don't have the issues around dependency and all those things. Which does mean in a sensible way you can stack things, you can add things to other things in a safe way. So magnesium is very safe.
Hmm.
It can be very calming and relaxing, and giving that either before or alongside something like melatonin can be helpful.
Hmm.
Um, it's always better if you're using a medication to discuss with your doctor, but your doctor really needs to know about nutrients and other things like that. So that might be a bit more kind of tricky, but
Yeah.
it's important you discuss these things
Mhm.
with the doctor of the child. But on a general level, you can stack these things together. And often I find for sleep a combination of magnesium with some L-theanine can be quite helpful. Um, Melatonin is something also that can be part of that as well. So it's about just being sensible
Okay.
and trying, especially for children, depending on how young they are. You
Mhm.
want to, you don't want too high doses of anything. But certainly it's possible to stack these things. They're
Okay.
not drugs that you have to be very careful about drug
Yeah.
interactions. And of
Yeah.
course, kind of herbs and nutrients. Yeah. There's also concerns around interactions around other things. So if you're
Hmm.
unsure, you have to definitely check with your doctor. But in general, you can stack some of these things together, these natural
These
nutrients
natural
and
thought producing.
yes, yeah,
That makes sense. You wanted to talk about food. Let's talk about food and how food is not the same as what it used to be. That was one of the things that we were going to discuss anyway. Let's
yes,
go ahead and talk about food because as parents, and I'm not sure if you're a parent, but we
I am. Yes,
okay,
yeah,
great. So we can get bombarded, and our children get bombarded with what's bright and colored, what the other kids are eating in the playground and things like that. And it's very easy to just pick up convenient food. And one of the things that I do explore with the parents that I work with is what are your children eating? What are you sending them to school with, in their packed lunches or as their breakfast? And optimizing their food and, water, drinks is really important. So, what's your take on food and how it's not what it used to be and what we can do? What can we change?
well, I would say this is really a hidden or less hidden war on the health of our
Mm,
future. We know that food companies are allowed to really do what they want. There's less regulation here. A lot
mhm.
of the food, so-called food, should really be banned. But we know there's corporate interests that affect policy and governance around these things, like with everything else.
Mm,
So it's really about understanding what we're facing, and b making a stand. And the stand comes really with yourself as a parent first,
yeah, I agree upon
because
that.
as you know, children don't do what you say, they do
Mm,
what you do.
yeah, exactly.
Eventually, even if they don't like it at the beginning, they end up doing what you're doing, and I've seen that for my own kids.
Yeah.
um, that's the only way. So if you want your kids to eat better and to lead healthier lives, you have to be doing it yourself.
Mm,
And part of that then is what you make available to the home. What options are there in your home in the cupboards?
yeah.
And that's a real fundamental thing. It's not going to work otherwise.
No,
And
I totally agree upon that. I totally, and that is the ethos that we have in our house. So we're very health conscious as a family. We're very much into our gyms. We're very much into exercise as a whole family. But food is top in our house. We're always discussing, where are the proteins, where are the carbs, where are the nutrients. And unfortunately, we don't have Cocoa Pops and Frosties in our cupboards. And unfortunately, I do get parents saying, I don't know why my children's kicking off at school. And it's like, well,
Mhm.
they had Cocoa Pops for breakfast, full of sugar, and you've sent them on their way. What do you expect is going to happen?
Yeah.
So, I mean, making that, you think it's common knowledge, but sometimes that kind of relationship between food and the impact it has on your children and how they show up, then especially in
Yeah.
their behavior, is so important. And it
Yes.
is about what we do as parents and adults in the first place, and what we make available.
Yes. But also appreciating that actually this is life is very difficult for a lot of
Mm.
people. And being a parent these days is a lot more difficult than being a
Yes.
parent, I think, ever before. And
Yeah.
each generation, it's parents learning how to be parents with the
Yeah.
changing pressures of society and
Mm.
everything that shifts. So we can't parent like our parents because we're in a different time and age, and our kids
Mm.
will hopefully parent in a different way because of the different demands on them. So we're all learning, we're always constantly learning
Definitely.
as adults and parents in particular. And there's a lot of information out there that tells us it's okay, right? So if something's in the shop, then and it's got some stamps to say, oh, it's been approved, or it's has these regulations, then surely it's okay.
Yeah.
But unfortunately, it's not.
No.
And there's two issues. So there's food that we eat that isn't as nutritious as before. So and that's been shown that the topsoil on the
Mm.
planet, because it's over farmed, is about 30% less nutritious. So things that are grown are 30% roughly less nutritious than they were 30 years ago. So we're getting less from eating the same kinds of foods
Mm.
as our parents did or when we did when we were younger. Um, that's the first thing. And then the other thing, the other side of things is the food that we do eat. They introduce whole level of toxicities, chemicals that play havoc with our brain,
Yeah.
and our body and our development. And they're really the two prongs of the onslaught that we're facing as parents,
Yeah.
uh, trying to make sure that kids are having enough nutritious food and less minimal toxic food. And I
Mm.
guess as a general piece of advice is not to get too anal about these things.
Mhm.
And I have a rough rule that I've kind of made up through my
Yeah.
own practice and sense that if you do 80% of the things that you need to do 80% of the time, that's
Yeah.
generally okay for most people.
Yeah. Yeah.
So it's not getting too anxious the other way around
Exactly.
that things have to be
Yeah.
a certain way because the truth is we don't know what exactly one person has to do in terms of their nutritional
Mm.
intake and foods. It just varies on so many factors.
Mm.
And as parents, we can only do the best we can,
Yeah.
but it's not about trying to be perfect in some sense
No,
because
not at
that
all. Not
doesn't
trying to be
exist
perfect,
either.
but yeah, just trying to make those little shifts where we can. And you're right, every child's different. I can even see with
Yeah.
my own child. I've got one child who is happy to eat meat, happy to try different things. I've got one child, it's like, does it smell right? Does it look right? So there's a sort of sensory processing issue around
Mhm.
food. So now my battle is how do I give the right foods with the right nutrition to somebody who doesn't really like eating that much? So it's a varied thing between
Mhm.
children, between families. So you're right, 80% not getting too anal about it and just trying our best to give them the best options, the best availability, and for them to be able to make better choices when they get older too.
Yes, yeah, and again, that comes from what they see you doing,
Yes, yeah,
because that's what it is. We impact on our kids more than we realize,
yeah,
and
yeah,
when we get to our ages, we realize, gosh, we're more like our parents than we'd
yeah,
like to be. Probably most of us spend most of our lives trying to be different to our parents, and then when you
yeah,
get to middle age, you realize that actually you're more, more like them than you'd like to admit, and that's because of our learning and our
yeah,
development. They imprint upon our minds in a ways that we don't realize or appreciate.
yeah,
So everything you do will affect everything they
yeah,
do when they're younger. And as a psychiatrist, I see the negative side of that when kids are not parented in a way that's with love and
mm,
consideration and just the
mm,
havoc that can play on adults later on. So it's certainly there. So it's certainly it may not feel like it that if we're looking at just outcomes, what is Johnny doing? Is he able to do this? Is he able to go? What's it? What is it? It's more a lot. Half of it is how we are with our children,
yes, yeah,
and that's also a really key message. So if their kids see us stressed and highly strong about food, about
yeah,
food,
exactly.
then they're going to develop a complex around it. So
Mm,
you know your kids better than anyone,
yeah,
and no one can tell you exactly how to do it, but it's these basic principles, and we're looking at higher protein
yeah,
in meals. Carbs, I think it's slightly less of an issue for kids because
yeah,
the metabolism and they're growing, and especially if they're doing sports and they're active and things that we want them to do, especially if they have something like ADHD, we want to encourage that energy that a lot of kids with neurodiversity have. So complex carbs as much as possible. The main thing is about sugar at that age, and this sort of shown that the biggest source of sugar intake is sugary drinks. So trying to just do one switch, if you're going to do one change after today, just looking at the sugary drinks that your kids have, and that can make a real big difference because most of the unhelpful refined sugars come from those when we look at
Yeah.
kids' diets.
Yeah. That's a big takeaway. Yeah, just shifting the soft drinks and
Yeah.
the juices and the extra sugary things in drinks makes such
Yes.
a big impact. So parents,
Yes.
listen to that one. That's an important one. Let's talk about ADHD because you want to talk about the concept of treatment of ADHD. So again, we've got parents that are either waiting for an assessment, they've had their diagnosis, they don't know whether to medicate, they've medicated. So we can be on any part of this on this spectrum of where they are. But the one thing I like about your work is that it's not about assessment, diagnosis, take medication or not. You've got a whole thing around it. So your treatment of ADHD seems to be a lot different. And you
Yes.
talk about lots of things, especially in the videos that I've watched. Would you mind just explaining all that for us?
Yes. Yes. With pleasure. So I guess the terms of reference are important. So
Hmm.
when you see a doctor, the doctor's training is one of symptom recognition
Hmm.
and then symptom management.
Yeah.
Uh, and nowhere in medical school um, do we get taught on how to be healthy, how to cure something. That's very important. So, doctors about recognizing symptoms, giving diagnosis, and then giving the drug to reduce the symptom, and that's a good outcome. Or you're not in pain anymore, or you can think better now, or you can sleep better now. That's
Mm.
I'm doing my job. And if that doesn't work, then we chop that thing out if we can. So, it's out now. Your uterus is out because you don't get any painful menstruation now. We've chopped you. We've done our job. So that unfortunately is the training and the mindset, and whether doctors like to admit it or not, treatments are drugs. And drugs generally work by blocking something in the body in order to alleviate symptoms. Okay, fine. They certainly have a role to play, but it's got nothing to do with healing. It's got nothing to do with cure. And so when we look at ADHD in particular, the ADHD meds, they block, so if you're looking at stimulants, they block receptors in the brain to allow dopamine to hang around long enough. And with high levels of dopamine, it can have potentially a profound impact on behavior and focus, attention, all the core features of ADHD. And I work a lot with the medications, and I'm certainly not
Yeah.
anti-medication at all,
Okay.
but it's just understanding, what we're doing here. So the medications don't heal anything, okay, and that's a key message.
Yeah. That is.
So that's why, for me, that's not enough. That's not why I became a doctor, to try and just stop symptoms. Is try and actually help people make tangible benefits. And that's also why I'm not in the NHS anymore, because that's very driven top down on what you can do, what you can't do. Um, and so I've had to work for myself and be able to offer people options. And that's very important. You can't be explained fine. Drugs will reduce symptoms. But if we look at lifestyle medicine, they're investments in your health. And when you invest in your health, things change, things improve. And we're
Mm.
looking at ADHD in particular. People with ADHD have low nutrients, they have inflammation in the brain, they have inflammation in the gut. There's a whole range of factors driving this brain that is might be very functional at certain times, but very dysfunctional at other times. And you can help the brain upregulate and improve how it works. The brain is the most complex thing in the whole entire universe. Okay. So for doctors to say, oh, well, you're stuck with the brain that you've got because your brain's your brain and we can't change it, is ludicrous. It's
Yeah.
actually ludicrous.
And that's really harsh for parents because when you are given a diagnosis and say if you've got as a parent you've got no knowledge of what ADHD is and you're just given this diagnosis for your child, it can be really shocking and you're thinking, God, I need to help my child, I need to fix my child, I need to support them. School life is really hard for them, and it gets them really stuck and they can get trapped in just medication only. And I've seen with parents where they've gone to their psychiatrist and they've talked about medication. And they've talked about, my child's still acting out, or they're still really angry and they're still having lashing out. And their answer to that was, okay, we'll up the medication. And they come back thinking, I didn't want to up the medication. I
Yeah.
need something else. What else can I do to support their behavior? What else can I do to support their anger and their frustration? And it can't just be only increasing medication dosage. And it's really upsetting. It's really frustrating for the parents who are stuck in with certain doctors who just want to prescribe the next dosage.
Yeah, well, it's about expectations, I think,
Mm,
because you go to a doctor, that's the only thing I would expect from a doctor
yeah,
is to
yeah,
increase your medication if you've got a problem. Because what else can they offer you?
yeah,
Nothing, nothing.
nothing.
Um, so and I have to say, some kids need
Yeah.
medication. That's the thing. I'm not anti-medication.
Exactly,
Some
because
kids,
it
yeah,
works well for
because it
some.
works well, and so it's about the risks and benefits of
Mm,
treated versus untreated ADHD.
mm,
And what we see hands down, if you've got kids that have treated ADHD, their life outcomes, talking about wealth, health, longevity, is much better.
yeah,
Okay, so that's key. So
yeah,
the primary objective is how can we treat the child in order to progress and to go be on that trajectory
yeah.
that we all want for them. And and treatment changes over time, but
Hmm.
you do what you need to do in the moment and the circumstances that you're in. And some kids just need the meds.
Yeah,
But the message for parents is meds is not the only option. And if I was kind of considering that for a child, I would think, okay, fine, meds is always there as an option. What about these other things? What
hmm,
changes can we make
hmm,
in day-to-day life, in habits? What evidence-based supplements can we give
hmm.
that don't have those toxic impact of the medication? Because with the drugs and with everything, it's risk benefit. So there are other options for parents,
Yes,
and
100%.
then it's the parents' choice, and it's what they can manage, and there's no judgment on that
No.
whatsoever. And so some kids need meds because that's just what they need, and that's what the parents can manage. Who knows? Everyone has different challenges in their lives as parents, but there's a lot more to it if you don't want that, or if you want things on top of the medication, or if you want things to help while the medication is working. So in the longer term, you don't need to be reliant on the
Yeah,
meds.
yeah.
Hmm.
Exercise is a big one. Um,
Yes,
yeah.
yes. Exercise is massive. So that's a
Really
natural
helps.
way. It's probably the most healthiest way to get dopamine
Yeah,
and these neurochemicals and endorphins that are released when you're active and exercising. And we know exercise really helps brain function, also helps brain development. There are things like BDNF, which is something that nourishes essentially our nerves and neurons and development and connections. And so it's really key part of my all my ADHD treatment protocols.
yeah. Exercise is key, and sometimes we hear, oh, but they're all hyper and they're jumping up around. Why do we need to do more? And it is about, yeah, releasing that energy from their body, releasing sometimes the tension that they have in their joints and in their body that they do feel. That deep pressure work
Yes,
really makes
yes.
a difference.
And,
Um,
and also doing things like team sports, especially
mm,
at a younger age, and making connections, really important because what I see over and over again working with a lot of adults with ADHD is that self-esteem, mood, anxiety, all these things are big features. I see them as consequences of untreated ADHD
mm,
also.
mm,
So
mm.
the mental health impact. And if you can encourage positive relationships, positive
Yeah,
experiences, all these
yeah,
things to help grow self-esteem and exercise, it can really do that as well as the
yeah,
intrinsic benefits of the exercise. So there's
yeah,
many reasons why exercise is so important for neurodevelopmental
yeah.
young minds.
No, that's so true. And especially if it's a sport related, like a team related thing. So they can build
Mhm.
the social skills. And then
Yes.
there's, the executive functioning, the skills that they can learn around that when it comes to working as a team. That is brilliant. Right. Let's have a look at, no, thank you so much for sharing all this information. I really appreciate it. And I'm sure everyone's going to appreciate these big takeaways. So we've talked about medication, we've talked about treatments. I know that lots of parents are going to say the wait on NHS is just horrendous for an assessment. But you've just said that you don't really work with NHS anymore, so you probably don't have much of a stance. But And that, so in the meantime, what they can do is all these other things, getting exercise in, looking at nutrients, looking at deficiencies, looking at the food that they can do whilst they're waiting, sometimes up to a year for an assessment.
Yes, I think it's unacceptable. I think it's unacceptable for doctors to say, okay, I recognize there's a problem. We need to get on top of it. Go on a waiting list. That's 5 years, 4 years, 2 years. It's unacceptable.
It really,
And it shows you something about a doctor who's not necessarily happy, but happy to go into work, get their paycheck, and go home, irrespective of what's going on. Like it's
mm,
untenable. And I think
mm,
a lot of these problems are driven by doctors not standing up and holding on to the values that they might give lip service to, because
mm,
it's not dignified,
no,
and if you want a regular job, just for do something else. Don't
yeah,
pretend to be a doctor, because
yeah,
it's just not good enough.
yeah. So they really
It's
need to
really
sort
not
of
good enough.
push for
And
assessments to get done quicker.
yeah, so that's one part of it. Okay, fine. So we've got the system that you're in, and if things are going to take time, okay, fine. You may have to wait, but there's so much you can do.
Yeah.
If I can find the literature and the research and find examples of amazing doctors across the world really making a difference for people, but everyone's got access to all the information in the
Yeah.
world that's ever existed on a mobile phone. There's no
Mm,
excuse for your doctor they can apologize for a long waiting list, okay, but there's no excuse for them not to give you anything meaningful
yeah. Yeah.
whilst you're waiting. All
Exactly.
this, everything I've learned is things that I've learned, that things that are available. There's no hidden science or secret meetings
Yeah, that's so
or,
true. That is
epiphanies that I've
so
got while
true.
I was in the shower or asleep.
No.
No, it doesn't work like that. The information is there. So there's no excuse for doctors not to say, okay, unfortunately, there's a long waiting list, there's 2 years, but these are all the things you
All
can
things we
do
could do.
that the
Yeah.
research shows that can really make a big difference. And look here,
Yeah.
let's work on this.
Yes.
Uh, but you just don't see that, and it's a
And you don't,
phase.
yeah. And a lot of parents, they end up in a situation where they've done the first part and now they're just waiting and it's just like
Yes,
nothing, no
yeah,
communication, no information. They're not sure what to do. So they are
yes,
stuck. And, it's a very tricky situation because then they're in the school
yes,
system that doesn't
yes,
support them
yes,
because they don't have a diagnosis. They don't know what
yes.
to do.
And I would just get now. So this is. I mean, I probably should write my own book, but I don't. I haven't yet. So this is what I recommend.
Okay,
Um,
great. Thank you for sharing.
Finally Focused by Dr. James Greenblatt. So he's an American-based psychiatrist, and very inspirational. It's a practical guide for parents with kids with ADHD.
That is amazing.
And so all the things you can do, a lot of the things that we've touched on today, it gives a bit more information, but also practical kind of, if your child is between this age and this age, look at this level of nutrients like this, or this type of, it's very practical. Um, and it's a great starting point. And there's a lot of progress parents can make by having a guide like this, and if they're on a waiting list. But even if you
Yeah,
have a child who's been diagnosed, or a child that has is on medication, or even God forbid, like any other child that you've got, and God forbid even yourself, the principles on here
yeah,
are basic principles, very helpful, but it is focused on ADHD and to have
yeah,
practical advice
yeah,
on kids and adults with ADHD. So
yeah.
yeah, it's about expectations now, and
Mm-hmm.
unfortunately, the expectations of doctors is very low. And
Mm-hmm.
I think the respect for doctors, I think rightly so, is probably at an all-time low, because a lot of people realize, I'm not actually
Yeah,
getting what I need. I'm not getting the
yeah,
help that I need, and
yeah,
so unfortunately, it has to come from you as a parent.
yeah.
And the good news is you don't need a degree or go to university or anything like that. If at the very least you do
Exactly.
is get a
Pick up the
copy of this
book
book and read through it,
and just,
and
yeah,
implement some of the strategies,
exactly. Just implement some stuff will be.
you can make a lot of progress. You can
Yeah,
make a
yeah,
lot of progress.
especially if they're also a parent that's got ADHD, possibly undiagnosed too, but they've noticed the symptoms that they've got or how they live their lifestyle
Yeah,
and live their life. They've just sort of trudged through and realized, oh my
yeah,
gosh, I'm exactly like my child. And
yeah. I see a lot of that.
I
Yeah,
see,
I see.
yeah, yeah.
Yeah, yeah. I see a lot
It's,
of that.
they're like, hold on, but they're just like me.
Yeah,
Yeah, so they can
yeah,
even
exactly.
implement this for themselves because they
Yeah,
are probably nutrient deficient as adults. They probably do need to get involved with some kind of exercise, body movement, some mindfulness, some self-awareness about what's triggering them and what's making them dysregulated. so that they can then support their children whilst
Yeah.
they're waiting for a diagnosis, that magic pill that's going to come along to solve it all.
I'd say over 50% probably of parents of children with ADHD, one of them will probably have ADHD or at least some strong signs of it. Um, and yes, it
Yeah.
can certainly
Yeah.
benefit the parents in that way. It's something that has a high what we call hereditability. Like
Yeah.
you see it from one generation to another to another. The interesting thing is a lot of people conflate hereditability with genetics,
Yes.
the genetic disorder.
Yes.
Now, I've done a deep dive into the research looking at genetics for ADHD. Now, whereas there are some gene abnormalities that make you more susceptible to developing something like ADHD, there's nothing consistent. So
Mm.
the last paper I read looked at over 30, around 30 to 40 genes are involved,
Okay.
and they can't pinpoint, well, there's no genetic test, right? Because it's not that straightforward. There's genes can make you more susceptible to a lot of things, including ADHD, but it's the environment in the body that
Mm.
turns genes on and off that can
Mm.
help overcome some of the problems that faulty genes, if they exist, it's the environment that controls everything. So this idea of epigenetics is
Hmm.
very important, and that's something that gets missed in the dialogue. And when you invest in the environment of your body and your brain, you're going to impact any
Yes.
susceptibilities you have
Yes.
through your genes. So my understanding is that ADHD isn't a genetic disorder. There is no genetic test because then it would be a genetic disorder.
Yeah.
Genes play a role, but they play a role in everything. It's the environment that's far more important, that
Mm.
turns genes on and off, that helps you overcome vulnerabilities that certain genes may have. And what the paper, so the most recent paper from a couple of years back, it was like a review of the data for the genetic cause of ADHD. What they concluded quite
Hmm.
remarkably was the environment is more important.
Yeah, yeah. I'm glad you clarified that because that's something that always pops up. Like, is it genetic? They try to track it through the family, lineage and where did it come from? Where did it start? Is it something that we can prevent passing on? And so we have to have a better understanding around genetics and hereditary, because people are confused. They're looking at
Yeah.
all sorts of things on Google. They're looking at all sorts
Yes.
of things on these online platforms. So it's really great that we get some
Yes.
more information about genetics and
Yes.
hereditary. Because you do get it in families where one child's got ADHD and the other child hasn't. Even with twins, for example, one of the twins has got ADHD and the other one doesn't. And it's
Mhm.
like, well, what happened here? It's very interesting. Um,
Yes.
what could a mother who's pregnant or thinking about getting pregnant do to make her environment, her body, her actual environment more better to support, a new life into the world and, nobody, having a child that's neurotypical, I wouldn't say necessarily better, but just to make it optimal for everyone, what can a mother do when she's pregnant to support the environment to make it great for a new life that's coming into the world?
It's a great question. It's a really great question, and people don't talk about this enough. And I think in part because of the relative blame that can happen around.
Yeah,
Well,
exactly. And that's
you
why
don't
I'm
want to
talking
blame
about this very
mothers. Like,
delicately.
it's enough. It's a hard enough job as it is being a
Yeah,
mum and
yeah,
being pregnant. And
yeah.
now you're saying I need to do. There's things I can do
I
to make sure
know.
my kids. What are you saying here? So I guess first thing is, you know, biology is biology, right? So
Mm,
the man can't give birth, we're not designed that way. So it's the privilege and honor of women to be able to give new life in a way that, men can't. I think men are deprived of that,
yeah.
and it's a great honor and privilege, and that's my kind of starting point.
Yes.
However, along with the honor and privilege comes the equal and opposite is that actually then you have the responsibility in a
Responsibility.
sense
Yeah.
of how you are
Yeah.
is how you're going to create something biologically. So it's certainly not about criticism. It's just about
No,
the
and that's why I was
hard
that
facts
was
of life.
that's why I was posing that question very delicately and carefully because that mum guilt that pops up,
Yeah,
like, is it my fault? Did I do something
yeah,
wrong? Did I not eat something correctly? Did
yeah.
I not sleep enough? Was I too stressed? And all
Mhm,
of this pops up, and you're like,
mhm.
oh, it happened and it happened years ago. Now your child's 10 years old, for
Yeah.
example.
Yes.
We've got to move past that now. And
Yes.
what
It's
could they
not
do?
yes, it's not
Yeah.
blame, it's
No.
biology. And
Yeah.
that's it. So we need to take the guilt out of it,
Yes.
and destigmatize it, because there's a lot of stigma around that. And on a basic level, which we discussed earlier around nutrients. So if you're going to create something in your body, you need enough nutrients to be able to support it. And the if you're a mother or planning to be a mother, then really looking at your nutritional status is key.
Mm,
Um, and maybe doing some testing around that and trying to optimize the nutrients that you're taking,
yeah.
or at the very least, take a good quality multivitamin, to kind of fuel yourself in that way. And that's one of the processes of hereditability. If you've got a mother who's nutrient deficient, then her kid's more likely to be nutrient
Okay.
deficient. That's one thing. There was an interesting, very interesting study done in Japan a few years ago, looking at pregnant mothers and the rates of ADHD in children when they were 8 years old.
Okay.
Okay. Um, and what they looked at specifically was levels of inflammation
Mm,
in the body of the mother. And they looked at certain common inflammatory markers like CRP, IL-6. And what they showed was women who had high levels of inflammation in their body were much more likely to have children with ADHD by the time they were 8, diagnosed.
okay.
And the researchers uncharacteristically went as far as saying that inflammation is a direct cause of
Right.
ADHD.
Right.
Right? And that's astounding, because researchers don't like to make such
Yeah.
claims or such definitive, but they were very sure with the data that they had, that this was causative. So inflammation is a key driver also of ADHD, autism, and these are things that can also get passed down.
Right.
Um, and so inflammation, we're looking at, okay, fine. It comes back down to how you're eating. If you're eating junk food, processed foods, if you're not exercising, if you're not been looking after yourself, if you're not been sleeping well, all the core basics that we're talking about, stress management,
Yeah.
all those things affect inflammation. And the world is very hostile when it comes to being in a relaxed, calm state. Most of us are inflamed.
I was about to say that. I was like, are we not then just all inflamed
Yeah,
because of the Western
yeah,
society, that
yes,
quick hustle, moving, going to work,
yes,
that you got to do?
yes. But I guess a key message is that we're not talking about being helpless, because there's always things you
Mm,
can do.
mm, mm.
And you can only do what you can do, and no one else knows what you can do. But have you given it enough thought and consideration and strategizing in these aspects of your life?
Yeah.
Because it's not about a balance in the sense of 50-50, it's about investment. Are
Yeah.
you investing enough? And that's a very personalized thing. So
Yeah.
you only know if you've done enough. And if you think you've done what you can, then that's it.
Yeah.
There's no hang-ups, right?
No,
But if you
no.
haven't even thought about it, and it's still stuffing your face with McDonald's,
Yeah.
um, you know,
Yeah.
maybe that's something maybe to regret afterwards.
Yeah.
But on the whole, you can only do what you can do.
Yeah.
And when it comes to trying to look after your general health is very important. So nutrients, lifestyle habits, they're key. Uh, and and I think that's a great preparation for
Mm.
pregnancy. And even when you're pregnant, you do the best you can, but being mindful of these things. And I think that will reduce the risk of children developing and brains developing in ways that are unhelpful.
Yeah. Yeah. And if you do try your best with everything, you try to optimize everything and it still doesn't work out how you want it to be. Again, we're not pinpointing, we're not trying to make moms feel guilty for it.
Yeah,
Now we
yeah.
can help.
All it is, I see it in the other way. I say it's about empowering. Actually,
Yeah.
you can do things to
Yeah.
impact your health, and you can do things to impact the health of your children.
Yeah.
And everyone out there, everything out there is telling you there's nothing you can do.
Yeah.
Actually, this is
Yeah.
more of a message of hope and
Yes,
empowerment.
exactly.
Actually, there's
That we
lots you can
can.
do, and you can only do the best you can do, and then things work out. We've seen life, there's things that work out well, and there's things that don't work out
Yeah.
as we want or
Yeah.
planned.
Yeah.
Um, but that's it's not about the outcomes necessarily. It's
Yeah.
about empowering you to do the best you can. And
Exactly.
the first step is about the knowledge around those things. And
Mm,
that's
mm.
why I'm keen to pass the knowledge on the platforms that I have to raise awareness and empowerment, and that's really important.
That is really important because that awareness is so important when I'm working with parents and they have just figured out what ADHD is and they don't really understand, all the different parts of it and, what the triggers are, the different nuances, rejection, all of those things that come up, PDA, all these other different things that pop up and they're just like, we don't know what any of this stuff is. And the more awareness, the more knowledge they get around it, they're like, oh, that makes a lot more sense. And then they can just move away from the myths surrounding ADHD as well. There's lots of myths out there. And also start reframing how they perceive ADHD. Um, and seeing it as something that they can actually work with, that they can empower their children to have a positive outcome, even if they have got a formal diagnosis of ADHD, and not see it as a deficit, but see it as something that if we try to optimize it, try different strategies, different things, that we can actually get a great outcome from this brain that we've been given and the body that we've been given and the way that it functions. So it is about really empowering with lots of knowledge, new strategies to support them and
Yes,
reframing.
yes, and that's essentially what I do. I
Yes.
work with people to help them overcome the neurobiological and how that manifests in day-to-day life
Yeah. Yeah.
issues. So I see people make a lot of progress,
Yes. Yeah.
and in general, the earlier you start
Yeah.
with kids, the more progress you're going to make,
Yes.
and that's the
Yes.
general rule across the board. So,
Yeah.
there's a lot more potential to make a lot more progress working with kids in this way.
Yeah,
So it's
that
very exciting.
early
Yeah.
intervention is really, really, really key. So with ADHD, you also can get, if it's not treated effectively, if there's not any real good strategies, you can also get anxiety, depression, and other things like that. Do you mind just talking a bit more about the related things that can happen if ADHD is not addressed or supported in a helpful
Mhm.
manner?
Sure. So I see in adults,
Mm,
um, a lot have been misdiagnosed with depression and anxiety, or
okay.
not necessarily misdiagnosed, probably recognized as having depression and anxiety and
Okay.
full stop by their GPs. And often people have been on antidepressants.
That's
Most
it.
people have been on
Yeah.
antidepressants from their GPs because they present with mood issues and anxiety issues. And they work and help to varying degrees, often not that particularly helpful. And often a lot of people say, well, I know I'm not depressed, but something's not quite right. Um, and so mood issues, mood instability, anxiety, low self-esteem are big features
Hmm.
of mental health for adults with ADHD because it takes that time with the growing minds. Generally, children have an awareness that they're different, have
Yeah.
an awareness that I want to achieve, but I can't for
Mm.
some reason. I just can't get down and do the same as everyone else.
Yeah. Or even in
Uh,
the social element in the playground, they don't get the jokes. They don't know how to play
yes,
effectively. So they feel like they're just a bit more outside.
yes, they
Yeah.
feel they're different. They
Mm.
feel they're less than rather than different in a
Yeah.
positive
Yeah.
way.
Yeah.
Then you've got, maybe teachers making comments
Yeah.
about, oh, you just need to try harder a bit, or I can see, that kind of fuels things. Well, I'm trying. I don't know what you mean by trying to
This
concentrate
is my
more
best.
because this is my day. Like I don't know what you mean. And then then at home, if there's comments about parents who don't
Yeah.
kind of understand, or and just being a normal parent, like why don't you clean your room, or
Stop being so
what do you,
lazy.
yeah, it's so easy. Or why don't you just do what your brother and sister does? Like
Yeah.
it's just a normal
Yeah.
parent thing to say. But all
Yeah.
these things have a cumulative effect,
Yeah.
and it works to suppress the self-esteem, self-confidence, and some people that can be just like people pleasers and just really want to
Mm.
help and put other people first. But that's also just continuing to detriment their own self-esteem and their own kind of robustness in that way, and that fuels mood, depression. A big part of ADHD brains is the lack of emotional regulation.
Yes.
So what
Yes.
we have is in the brains of people with ADHD, they're more likely to have smaller or less active prefrontal cortex,
Yeah.
which is the front part of the brain that is involved in this idea of executive functioning. So helping you be rational, to weigh things up, to make decisions, plan, strategize. So that is more underactive
Yeah.
than kids without ADHD. And we have our emotional centers that are overactive. So there's an imbalance in the neurobiology. So kids with ADHD tend to be triggered more, tend to have more emotional outbursts, and are less able to control and say to themselves, well, maybe I shouldn't do this, or maybe it's not the end of the world.
Yeah.
The brains are wired in a way where they're more reactive.
Yeah.
So we see a lot of that playing out. And then that obviously continues into adulthood as well. And that can be seen as depression, anxiety, bipolar, borderline personality disorder, all these things can be mislabeled with
Hmm.
underlying ADHD. And I've seen that
All
many
right.
times.
That's interesting. That's interesting. So they go in with anxiety and depression, and actually it's ADHD because sometimes it's a case of I forgot to take my anxiety tablets because they've actually got ADHD and they can't do all the executive processing skills or remembering all their medications that they need to take. Um, I've got a question here regarding anxiety. Oh yeah. So does saffron help? Totally off, but this is from a parent. She's messaged in saying, does saffron help with ADHD slash anxiety?
Yes.
Do you know?
So it's interesting. There's a paper that I have ready. I was doing a post on it. It's just there, open on one of my browser
Okay.
tabs. So looking at saffron. So I've known for a fair bit of time that there's data around saffron helping with mood.
Okay.
Um, and there was a recent paper. I think it was a study in Iran looking at saffron for ADHD and showing improvements in ADHD
So you'll be
symptoms.
sharing that soon, then we'll be able to
Yes,
learn some more
yes.
because there's not much out there about saffron. So I was like, oh, well, that's
No,
an interesting
yeah.
question. And she also
So.
had another question, which was she has a daughter who's vegetarian
Mhm.
and she wants to increase, essential fatty acids. What's the best way of doing that if you're vegetarian?
It's probably still fish oil,
Yeah.
but you have non-animal um, sources like algae that can
Okay.
provide fish that can provide omega-3s. The challenge is often in lower concentrations. So in order to get the levels that we want for ADHD, so we're looking at, say, in an adult, we're looking at between 3 to 4 grams a day. In children, we're probably looking 2 to 3 grams or a bit less, depending on the age. So there are certainly sources
Okay.
of algae-based, plant-based omega-3s, but the downside is you need to take more of them in order to
Yeah.
get the levels.
Yeah. Probably like 12, 15 tablets or something like that. Oh gosh.
Yeah, yeah. I haven't looked into this as much. There is. It's also fish. I think the krill oil is an alternative, but I think that's also fish based.
Okay, great,
Yeah,
great. Right, I've got one final question, if you don't mind.
yeah,
And if there was one thing that you would say to every parent of an ADHD child, just one thing to do or to change or to stop, what would that be? It's one of those sort of trivial kind of questions, but really important one. Just one change or one thing to stop, one thing to add in. What would that be?
yeah. Um, so for me, it's a mindset. So it's what you tell yourself. So see your children as an extension of your health.
Wow.
Yeah,
Okay. Explain a bit more about that because I liked that. That's
yeah.
really good.
So I think sometimes there's a disconnect between what we think is good for us versus what we think is good for our children, and that because often they're a bit smaller. The smaller, well, they are smaller. The small people, they don't need quite the same level as maybe adults of quality or um, a kind of discernment around what we eat and what's convenient because they're fussy and this and that. Well, anything will do. We'll just
Mm,
get anything in. Um, it's understandable why that can be quite prevalent, but really they are an extension of your own health. So what you do and what you show your kids, they will take on board, and we can't expect kids' health to improve if you can't improve your own health and make those changes.
that's
And
amazing.
I say that because that's what I've had to do as well. When you kind of understand when the veil lifts and you think, gosh, okay. Um, and I've had to make those changes for me. Also, in order to make those changes for my children, and that's the only way. So I'm talking experience, and I think without that, it's a lot more difficult.
Because it's a different rule for them, a different rule for us. It's
Yeah,
just no, but actually they're an extension of our own health and
yeah,
well-being and what we model out to our children and having that
yes,
mindset shift.
yes,
I didn't think you were going to say that, but that's very interesting. I really like that's a really great takeaway because it's got me thinking about is there things that I just let my kids just eat or do that I wouldn't do or eat? I'm just thinking things like chicken nuggets, for example. Would I have that? But it's okay to give it because it's kiddie kind of food, but actually, how
Yeah.
nutrient dense are they? How great are
Yeah.
they?
And I guess it's finding that
Yeah,
that level,
yeah,
because you got
yeah,
to let kids be
yeah,
kids, right?
yeah. That
Uh,
balance.
you
Yeah,
got to let kids be kids, but we're talking more about regular stuff,
yeah,
so
yeah.
it's the routines. What routines are you in and your kids are in
Mm,
versus kids just being kids and having things now and again that they shouldn't. I think with ADHD in particular, that there's less room for tolerance around foods that are
mm,
harmful to the brain.
mm.
So that's the only caveat. So the more disciplined you are, the better it is for your kid's brain.
Yeah, yeah.
There's less room for error, and a lot of parents experience that. So um, again, it's figuring it out, but being equipped with these general principles hopefully will give parents a confidence to
Yes.
figure out what's best for their kids in that way.
Thank you. Thank you. Right. Thank you, Dr. Ali. How could people find out about you or follow you if they want to come to your clinic? How do they go about doing that? If you don't mind
So
sharing.
yeah, for sure. So at Dr. Ali Ajaz, AJAZ, it's on Instagram and TikTok, and I have a website where you can book in with me or send a message, uh, draliajaz.co.uk.
Right, okay. And for myself, if anyone wants to get in touch with me, it's Bakshi Sidhu at Little Ones Life Coach. I'm on Instagram, Facebook, TikTok, YouTube. We're all over the place, sharing information about how to support families, how to support our ADHD children. It's been so great talking to you. I've learned lots and I really appreciate it. And I'm going to take this information back to the families that I work with. And I really do appreciate your time today. Continue doing all your research and everything that you put out there. And we'll share all the links for the book, the micronutrients that you were talking about, the nutrients that you were talking about in the follow-up comments and things like that for all people to see. Thank you so much. I really appreciate it. Thank you.
Real pleasure. Thank you for your time.